Hello and welcome to another episode of the Foot Geeks. My name is CJ and today we'll be talking about Morton's Neuroma. Yes, Morton's Neuroma, not to be confused with Morton's toe. Morton's toe is something that we discussed in another episode, but what Morton's Neuroma really stands for is nerve pain. So most of the time when you have Morton's Neuroma, what you will notice is that you either have some numbness in the toes or there may be a little bit of pain going on in between the metatarsal bones. Usually the digits that are affected are the second and the third, or the third and the fourth. Most commonly the third and the fourth. Toes will feel numb. You may feel like a sharp burning sensation. You may feel like a zap, almost like an electric shock type feel. And that's because the nerve that runs in between the metatarsal bones here is being compressed. So as a result, the toes are responding that way, because of the fact that the nerve is being compressed. Now what is it that you can do about that? Now number one, most likely the problem is that the shoes are not wide enough. So as a result, you have potentially something that's squeezing the foot a little bit, and that's causing discomfort in that particular area. So if this is being squished together, it will cause discomfort in the neuroma, and a lot of times we'll see it in women, especially when you wear high heel shoes or dress shoes that have a little bit more of a curved last. And that's really something that we try to steer away from. If you have to wear high heel shoes, a few things you can do is use metatarsal pads. So these metatarsal pads right here is something that you can place inside the shoe to help space the bones apart. Now what you usually want to do is place that pad, just kind of behind where the pain is. If it's between the third and the fourth digit, what you want to do is you want to have the pad, kind of more or less in the center, and kind of behind the third metatarsal, which is the one in the middle. And as a result, what happens there is, as you have that pad kind of push up against the foot, it's going to help splay apart the bones, so that way there's less pressure on the nerve. It's kind of spreading it apart, helping to relieve some of the discomfort. Now there's a few things you can do also at home that you can use, for example, a cotton pad or something else that you can put in between the bones to help kind of spread them apart as well. There are socks like the toe menders here, which have little kind of spreading devices that can be used at night. These ones are designed to help spread the toes apart, improve the spacing in between the toes, and therefore reduce some of the pressure. If you're in running shoes and you may not have obviously the amount of space for this type of device, because this is really to be used without shoes, you can use toe socks, and that's been successful in some cases as well, because it helps to spread the bones apart a little bit by having each toe encompassed in its own separate little compartment, and that creates a little bit of extra spacing as well that can help reduce some of the discomfort. Now one of the great features of the correct toes is, again as well, is the factor that you have something that can really help spread your bones apart. They do come in different sizes, so don't be alarmed by the size of this particular spreader, but the correct toes have worked very well for a lot of our clients that do wear, that have issues with Morton's Neuroma. So this is kind of the correct toes design right there. As you can see, it will spread the bones apart. It will help improve the alignment of the toes not only, but also help improve the spacing and the circulation to the toes to potentially help some of the healing, as in some cases the nerve may be inflamed, which then kind of feels like a little pebble under the in the foot, as you're stepping on it. It may feel like almost like you're stepping on a little pebble, and potentially sometimes when you move in between the bones, you can feel that kind of moving back and forth, and that's kind of an inflammation of the nerve itself that we try to subside by spreading the toes apart and making sure you have enough room inside the shoes. Now if you have any other questions regarding Morton's Neuroma, please post your comments or questions below. We'd love to answer them. If you haven't subscribed to us on YouTube yet, we'd love for you to do so, as we've got lots more content coming, and we'll look forward to chatting with you soon. Have a great day.